This is an appeal to the public, an SOS, SOS, SOS. Our great governments knew of the coronavirus pandemic and did not manage to avert the coronavirus pandemic. I was travelling to work when on Radio 4 News they talked about the total antibiotic resistant bacterial super pandemic that Dr. Susan Hopkins of Imperial College London warns us of. We must act to prevent it today and not leave it. As Public Health England have said, we have a 5-year plan. Once we lose antibiotics, we have lost them for good. We cannot adjust to make the antibiotics work again. Without antibiotics, every ear infection can progress to infection behind the ear, mastoiditis, and that pus can erode the bone of the floor of the skull, and then pus enters into the brain, causing a cerebral abscess and death. Every wee infection can progress upwards to form a kidney infection, sepsis and death. So without antibiotics, there will be many deaths. I've spoken to funeral directors and they have reassured me that in London plans are already being agreed that where there is only one occupant in a grave, that grave will be deepened and there will be 6 occupants in that grave. The headstone with the name of the first occupant will be turned around, and then the back of the headstone will be engraved with the new 5 occupants. And it's not unforeseeable that should the total antibiotic resistant bacterial super pandemic strike in 10 years' time, then we will be converting our graveyards into mass burials. We will lift the headstones and put them around the periphery against the wall of the graveyard, and then excavate to produce mass graves. But we can avert it, and I believe in you, the public, that you will take action and rise to the challenge. Let's not shoot the messenger of bad news. Let's be that wiser man to benefit. As the saying goes, it is a wise man to give advice, but a wiser man to benefit. This is the photograph of bacterial superbugs you'll see in the Daily Mail online. Fears of infections pandemic grow after 19 new superbugs are discovered in the United Kingdom, including germs which attack the blood, the kidneys and the bowel. That second bullet point. They threaten a pandemic of untreatable infections. And Public Health England today announced a 5-star strategy to address the problem and the correspondent being Ben Spencer. The superbugs found in 1,300 different samples taken from patients meant infections could not be treated by antibiotics of last resort, the carbapenems and colistin. Public Health England today announces a 5-year strategy to address the urgent threats of infectious diseases. It had discovered 19 new genetic mechanisms of antibiotic resistance in its laboratories in 10 years. In each case, doctors were able to use experimental unlicensed drugs and combinations of old medications or high doses to save lives. Speaking at the annual Public Health Conference in Warwick, infectious disease expert Dr. Susan Hopkins of Imperial College London warned the doomsday scenario is that we cannot treat patients, i.e.
when the bacteria have become resistant to all known antibiotics. She said health authorities are desperately trying to avoid a tipping point in which drugs stop working against common infections. So if we can help, we should help.
This next pandemic, when bacteria are resistant to every known antibiotic, the total antibiotic resistant bacterial super pandemic will be a super pandemic. In my view, 40% of the population of the West will die. Every infection can progress to blood poisoning, and without antibiotics there'll be death. Infection of the coverings of the brain, meningitis, will lead to death. Infection of the gallbladder with its contents without antibiotics will become ascending cholangitis, sepsis and death. This was the major cause of death of women before antibiotics were invented. So female, fertile, 40, she'd had the children, she'd mixed the genes, produced individuals. Hopefully some of those had a build-up of white cells that could fight the new changed antibiotics, new changed bacteria. So she'd done her function and nature would get rid of her. So she'd get a fever, she got the infection of the gallbladder and she'd die. We then had a generation of widowers, men whose wives had died. Do we want to return back to the pre-antibiotic era again? A world of widowers whose wives had died from acute cholecystitis, which we presently manage to treat, and these women live with their husbands into retirement. I would definitely prefer not to be a widower. Working bacteria having become resistant to every known antibiotics, there will be mass unemployment in our National Health Service. Invasive surgery will not be performed as frequently as it is now, and the supporting staff to those surgeons will not be in employment. So keeping antibiotics working for future generations is keeping our nurses, our surgeons, our doctors in employment within the NHS, together with all the supporting staff that they require. The two specialties in which I am aware that antibiotic usage can be decreased is in urology during prostate biopsies. The second specialty is in birth or obstetrics. It is possible today to reduce our use of antibiotics within medicine by inquiring through Freedom of Information Act which hospitals locally to you, which hospital trusts actually provide percutaneous, through the skin, prostate biopsies under image fusion of transrectal ultrasound and MRI, and secondly, sharing the good news with mothers. You don't have to fear about tearing in childbirth, about having an episiotomy, a cut in a very delicate place, because you can gently, progressively, painlessly, it's most important, painlessly stretch the skin. If you're stretching skin and it's starting to hurt, you're starting to tear the skin, stop, have a rest, leave it a minimum of 12 hours or even 24 hours before attempting to stretch the skin again. So they're the 2 areas that we can decrease dramatically the use of antibiotics in medicine. In Great Britain alone, there are 750,000 births a year, plus or minus 2%, and 3/4 of those mums experience injury to the skin opening of the lower abdomen. And if we can avoid those, we dramatically avoid the number of times we give antibiotics, the number of times that bacteria see the antibiotic, and if they're in the right stage of growth and development, the bacteria can then become resistant to the antibiotics. So the power is with the people, saying, yes, we can stretch that skin painlessly, opening doors for baby to 10 centimetre diameter, avoiding tearing, avoiding the need for antibiotics. Thank you for your support.
We can all help keep antibiotics working for our children and grandchildren. Don't break skin. Don't let the bacteria in. Don't use antibiotics to fight the infection. Bacteria haven't seen the antibiotic and therefore cannot get resistant to the antibiotic. In that way, we can keep antibiotics working for future generations. We've enjoyed antibiotics in our lifetime. Why should our children and grandchildren not enjoy antibiotics also? Annibal is £65. It's a birth aiding device that promises no tearing, no cutting, no tearing into the anus. So no risk, no need to use antibiotics to fight the bacteria that are in the large bowel. At £65, it's not a big price to pay to keep antibiotics working. So when you in your old age need a hip replacement, there will be antibiotics working for you and you can benefit from the hip replacement. The childbirth trainer that does not slip out as you inflate it from the birth canal. If you type in Annibal on YouTube, you will have a demonstration of Annibal, slight improvement on Epino as it does not slip out of the birth canal whilst it's being inflated. I believe our mothers have a right to know in order to exercise their democratic right to choose, even though it is not available for free on our NHS. Episiotomy, the cutting of the skin underlying erectile tissue and pelvic floor muscle and peritoneum of the lower abdomen in an emergency to aid baby exiting mum's tummy, is performed by the midwife, and it is totally avoidable. It is a devastating procedure because it permanently weakens the floor on the side of the episiotomy. The muscles that lose innervation by nerves that are from the back dies off and becomes replaced by scar tissue, and hence the increased incidence of prolapse of uterus, the front wall and back walls of the birth canal 10-15 years on following the episiotomy, and in old age incontinence of urine and stool, which can become a big problem and cause breakdown of skin, pressure sores and ulcers of the skin in old age. This is totally avoidable with skin stretching painlessly, either with Annibal or Epinodelphine Plus or antenatal perineal massage. They all birth canal widen, and hence this is referred to as abuse of mothers in childbirth, because they have not been informed that they can avoid these complications by gently stretching skin. This is what Professor Lord Winston is referring to in the words abuse and violation of the human rights. Human rights, because if you tear perineal skin or you cut perineal skin and a mum is drinking a lot of fluid to keep her breast milk flowing, she is passing urine every 3 to 4 hours, she is bathing this wound that is full thickness penetrating injury of the lower abdomen with hot salty urine, and tears stream down her cheeks uncontrollably every 3 to 4 hours for the first 14 days as that wound heals, and mothers describe this experience as torture. So there is violation of the Human Rights, Universal Declaration of Human Rights Act, Article 5, a citizen's right to be free from cruelty. So, and this, the price of this is that this wound being close to the anus gets infected. We give antibiotics to treat the infection, the abscess, the necrotizing fasciitis, the infection of the pelvic floor muscle itself. Necrotizing means necrosis or rotting. Fascia is the covering
fibrous coat of the pelvic floor muscle, and by giving antibiotics to mothers to settle this infection, we are giving an opportunity to bacteria to gain resistance to yet more antibiotics. There are 5 differences between the bacterial cell and the human cell, and this is taken advantage of by the 5 groups of antibiotics. And once a bacterium has become resistant to one of the antibiotics within that group, it is resistant to all the antibiotics within that group. Hence this urgency to decrease our use of antibiotics before bacteria become resistant to every known antibiotic.
On YouTube there is now a flurry of videos. As you can see, the very bottom one says, "Is it time to abandon transrectal, also known as transfecal, prostate biopsy, which is associated with sepsis in 5% of cases, and sepsis is associated with loss of limb and occasional death, for a much cleaner through the skin biopsy called transperineal prostate biopsy?" And as a man, I would argue yes. The high quality image that is obtained from a MRI, magnetic resonance imaging, mapped onto that obtained from the ultrasound, transrectal ultrasound image, and then you are biopsying the area that is suspicious of the cancer, so you don't miss the cancer. This is the MRI image mapped onto the ultrasound image so that there is accuracy of biopsy. Even under multiple antibiotic cover, taking a needle biopsy through the rectal wall, even after the large bowel has been emptied by an enema, there will still be bacteria there, and it is not the cleanest way of biopsying the prostate. And Dr. Simon Bott, advantages of transperineal fusion prostate biopsy under local anesthesia. This is Epino, the world's first birth facilitating device that went worldwide in January 1999, almost 20 years ago, and it's presented by birth companions or doulas, so the midwife, the obstetrician, and now the doula are there to ensure mother has as good a birth experience as possible. And they are the videos: birthing with no tearing, no episiotomy. The title, the promise in the title, Epino, is episiotomy none, made by a German hospital consultant obstetrician, Wilhelm Horkel. And at the bottom of the screen, it is also beneficial for those mothers who are giving birth to their 2nd or 3rd child, since the fibrous coat of the pelvic floor muscle toughens up if it is not repeatedly stretched, much like if you injure your elbow and your arm is placed into a sling bent at 90 degrees. After 2, 3 weeks, 6 weeks, the pain's eased off, and then you've got to gradually re-stretch the fibrous coat of the muscles around whose ligaments pass around the elbow, in order for you to get full extension, straightening of your arm. So it's much like having a window under the stairs in a new house, and you move in and you want a toilet in underneath your stairs. If you force the window in one go, you're likely to crack the pane and damage the wooden frame. But if you pick at the paint at the hinges, oil the hinges, then pick at the paint around the periphery of the frame or of the window, and gradually, slowly mobilize the opening of the window, you will achieve an intact wooden frame and an unbroken glass. Similarly, here we have the pelvic floor, which hasn't been used before, to enable baby to exit mum's tummy. The only time there is any movement in the pelvic floor is when it relaxes and allows the poo from the large bowel to exit mum's tummy. So you are increasing the range of movement of the pelvic floor. So from acting as a floor to the tummy, it then also acts as a trap door.
that allows baby out. First time that the uterus pushes baby's head into that floor, and then this way it shortens birth. The last 2 hours of pushing to 20 minutes.
This is the prospective randomised multi-centre trial with birth trainer Epino Delphine Plus for the prevention of perineal trauma. 2009 Australia and New Zealand trial you'll find on the Epino website.
In the discussion section you'll find because of the low recruitment, we were only able to randomise 276 patients. Prejudice of midwives and obstetricians against the new device was some factors for low recruitment. Interestingly, even with the low sample size, a significant benefit for the perineum throughout the training was observed, and there was an overall reduction in episiotomies, as in the German previous trial, from 60% 2002 to 37%. Cochrane collaborate meaning working together, of specialists from around the world. They have reviewed every single medical trial done in each specialty, and they write a summary, a report. And this is the Cochrane collaborate on anti in front of, natal as in nativity, the birth scene of Christ, before birth, perineal massage for reducing perineal trauma, and the line concludes, women should be informed about the benefits of digital, meaning fingertip antenatal before birth, perineal skin between the legs or birth canal opening. Massage refers to the very gentle, painless stretching of skin achieved by baby's head under the influence of each uterine contraction in the last 2 hours of birth. So women should be informed about the benefits of digital antenatal perineal massage or birth canal widening. And the author's conclusion: antenatal digital perineal massage reduces the likelihood of perineal trauma, mainly episiotomies, and the reporting of ongoing perineal pain, and is well tolerated. This is Ina May Gaskin, Reducing the Fear of Birth in US Culture. She is effectively a Nobel Prize winner for introducing the midwives to the Amish of Pennsylvania. This is the brass Peruvian birth educational plaque that shows birth canal widening using the 4 fingers of both hands pulling away from the centre. Was used as a traditional method of aiding birth, and it appears on Reducing the Fear of Birth in US Culture by Ina May Gaskin. And this is the birth educational carving on an 11th century Welsh church that shows that birth canal widening was used as a method of aiding birth. It is still the traditional method of aiding birth by the Chukchi Eskimos of Siberia and the African peoples, who decorate their bodies by stretching skin of their earlobes, their lower lip and their neck to communicate joyfully to others that skin stretching avoids tearing, avoids infection and death of wives. So it is our cultural heritage, and it was used at least up to the 11th century, until the Huguenots fleeing persecution in France brought their tool of trade, forceps, to Great Britain and became popular with Charles I.
10 centimeters, 10 centimeters, it's all, yes, oh baby needs to exit, exit mum's tongue.
Once you have birth canal widened to 10 centimeters diameter, which is the diameter of the pelvic outlet, you cannot increase this diameter any further. And this is what is shown in the next photograph from a YouTube video made by obstetricians. If you do not wish to see baby exiting mum's tummy, please cover your eyes now. All this photograph shows, 99.5% of it is baby's head, and there is a rim of pink skin tissue around the periphery. There is no exposure of any external genitalia because they are distorted to such a degree that you cannot see them. This is full natural childbirth obstetrics. This is what the child would see when it was on a farm. In spring, the cow giving birth to a calf, the mare giving birth to a foal, and the sow giving birth to piglets coming out through a round hole. It was normal. There was nothing inappropriate. This was part of life. The choice is ours. We can leave the baby to use its own very delicate head to gradually, progressively stretch the fibrous coats of the muscles that make the pelvic floor and the skin, or we can help baby to exit mum's tum by birth canal widening to 10 centimeters diameter prior to birth. And now that the Football Association has banned heading of the football because it's shown that though heading of the football increases the incidence of dementia, that further supports the evidence that there may be a chance in childbirth by birth canal widening to 10 centimeters that you will be pushing dementia and Parkinson's further into old age for your baby. Muhammad Ali had lots of blows to the head from boxing, and he developed early onset Parkinson's and dementia. So there are many benefits to birth canal widening for baby, both to mum and to baby. For the mum, there's less acidosis, less lactic acid buildup in the blood. The uterus is not as tired, in other words, and will contract down, closing off the bleeding points, so there'll be less blood loss for mum. So episiotomy is totally avoidable, and tearing in the most cases also avoidable. So why are we still doing episiotomies in our obstetric units to this day? Because we don't inform mothers that we can gently stretch skin painlessly over the week before birth. And plastic surgeons use this technique and they call it skin tissue expansion. It has become popular to show the degree to which earlobe expansion is possible. And here's a photograph of earlobe expansion. Once you expand the skin, there's no underlying muscle, therefore the skin remains stretched and expanded, unlike the pelvic floor that contracts and closes off the opening to the lower abdomen. You can tell the mothers that this is the painless option. Caesarean section involves cutting the skin 14 days after the caesarean, up to 14 days of healing of the caesarean section. When breastfeeding, mum will have to hold the baby at her side and not on the front of the tummy because it will be sore. Whilst with skin tissue expansion, the front of the tummy is not sore. And reports on both birth trainers say that mums within 48 hours feel back to normal. And in the past it has been the case.
when mothers had 12 children. They would give birth and carry on making the evening meal and serve the evening meal to their children. You can reassure men that you're not damaging your wife. You're aiding the birth of your baby and saving your wife from tearing, from having an episiotomy inflicted on her, which is irreversible damage. By stretching the fibrous coat, you're doing some of the hard work of birth, saving her back, keeping her back in better condition. And by shortening birth, you decrease the risk of lack of oxygen to baby's brain, hypoxia, because the longer the birth, the closer together, the shorter the time between contractions of the uterus, so the greater the risk of baby having insufficient oxygen to the brain and therefore losing brain cells. So birth canal widening to 10 centimetre diameter doesn't damage baby, it doesn't damage mum, because you're just stretching the fibrous coat without damaging the muscle fibres themselves. So you're making the floor elastic and it will recoil back. Once baby has exited mother's tum, the muscles contract back down. As grandma said to her grandson in primary school, who was very curious how was it possible that his baby sister filled almost the entire tummy of mummy. How could the baby come out of mummy's tummy without damaging? He'd seen a laburnum pod split in two and fling the laburnum seeds across the lawn, and yet mother was intact. And grandma said to her grandson, there's a special opening that stretches to an unimaginable degree, lets baby out and then contracts back. That is the property of muscle. It stretches and then contracts back. So that opening will close off. You don't damage wife, you don't leave her with a 10 centimetre diameter opening, as there is in the bony pelvis that allows the baby out. So there's the explanation to reassure the dads that birth has evolved over many years to be efficient and be successful. That's how we are here today, because of our grandmothers, our great-great-grandmothers, managing to give birth normally.
If mum's birth canal widened to 10 centimetre diameter are allowed to drink and eat during labour and to rest and sleep in between, most women who are healthy without any medical complications such as high blood pressure, preeclampsia or diabetes would be able to give birth normally without requiring an episiotomy, forceps, 1/2 cap or caesarean sections.
If mothers, it is explained to mothers that the traditional method of shortening birth used by the Eskimo people and by the African tribals people is skin stretching. Painless skin stretching, also used in plastic surgery and known as skin tissue expansion, is what we need to do to avoid the next pandemic, the pandemic of total antibiotic resistant bacteria. Total antibiotic resistant bacterial, it will be a super pandemic.
Essential parent in safe hands.
By Professor Winston, I'm sure you recognise the face.
Expert advice by Professor Robert Winston and a team of medical experts. How has birth changed through history in the UK? In the early 20th century, less than 5% of women gave birth in hospital. Before the NHS started in 1948, babies were usually born at home or in nursing home run by midwives. After 1950, birth became increasingly medicalised in the hands of the obstetricians, and in 1970s more dads were encouraged to be present at birth.
In the 1950s, hospital births became increasingly the norm, and dads were not present at birth. There was an increasing medicalization of birth, with the care of the pregnant woman and labouring women being increasingly managed by obstetricians. Birth was increasingly treated as a pathology, an illness that needed treatment. This was most extreme in the United States, where women were often anaesthetised and babies delivered with women laying on their backs with legs up in stirrups. Assisted birth with forceps delivery was more common, and an episiotomy was often routine. Induction of birth was sometimes arranged to make sure that a woman would have the labour when her obstetrician was present in the hospital. In India, the wealthiest women and those
using the private sector have the highest caesarean section rates. In Brazil, both labour, inductions and caesarean sections increased over time from 3% to 43% and 26% to 43% respectively. So an increase in inductions and an increase in caesarean sections. These increases were associated in time with increased preterm births rates from 6% to 16%, so without any improvements in neonatal mortality. Efforts to generate revenue and convenience increase intervention rates. So in America, every doctor has his own private hospital, and to help pay off the costs on the private property, there is this bias towards maximising the number of caesarean sections they do. By coming into facilities that use unnecessary obstetric intervention, these women are potentially being exposed to harm, and few are in a position to give full informed consent or are told of the risks of these interventions. Too much too soon care is unnecessary, potentially harmful, increases health costs, and can be a sign of disrespect and abuse. The defence for caesarean sections, the rates as they are, is that the obstetricians are often sued, usually because of neurologically compromised or damaged infants, and practice defensive medicine that includes high levels of intervention, caesarean sections. Medical liability reforms such as no-fault systems, at least for neurological impaired infants, those with cerebral palsy, may help reduce caesarean section rates. There is a shortage of clear clinical guidelines and little adhesion to existing guidelines. All women should receive high quality, evidence-based, equitable and respectful care. The right amount of care needs to be offered at the right time and delivered in a manner that respects, protects and promotes human rights, which are powerful words in the Lancet. The Universal Declaration of Human Rights, 1948, Article 5. No one shall be subject to torture or to cruel, inhumane, degrading treatment or punishment. Mums described the first 14 days of healing as torture.
How can too much too soon be reduced? By better regulation and ensuring that there is adhesion to evidence-based guidelines, particularly those of Cochrane.
General Medical Council's responsibility is to protect, promote
and maintain the health and safety of the public. This is an article from the British Medical Journal, BMJ. Has the medicalisation of childbirth gone too far? Professor Richard Johnson and colleagues argue here that perhaps normal birth has become too medicalised.
Summary points: obstetricians play an important role
in preserving lives when there are complications of pregnancy or labour. In developed countries, however, obstetricians' involvement and medical interventions have become a routine in normal childbirth without evidence of effectiveness. Factors associated with increased obstetric interventions seemed to include private practice, as in the United States, medical legal pressures, particularly in the cases of babies with cerebral palsy, the cause of which is still not clear, and not involving women fully in decision making. Well, there needs to be more in the antenatal clinic explanation of terms like episiotomy and the complications of long-term complications of episiotomies, which women are totally unaware of, and basically when there is fetal distress, the mother simply asked to consent to have the procedure performed. Emerging evidence suggests that higher rates of normal births are linked to beliefs about birth. So if a woman believes that my great-grandmother gave birth normally, my great-grandmother gave birth normally, my grandmother and my mother all gave birth normally, then I am capable of giving birth normally without resorting to a caesarean section. So mothers believing in themselves, and implementation of evidence-based practice as advised by Cochrane, and working in teams with the midwife. Mistakes on maternity ward setting the NHS back almost £1 billion a year.
Data obtained by former cabinet member Jeremy Hunt through a Freedom of Information request showed twice as much being spent on settled disputes as staff in obstetrics are getting paid. So there is the other area in which we can decrease antibiotic use, as every caesarean section, every episiotomy has a risk of getting infected. Caesarean sections are given antibiotic cover
as the skin is incised so that the
blade, the knife that cuts the skin, doesn't bring cells that are infected with the bacteria deep into the wall of the uterus, and then the uterus, when it's stitched back up, has these bacteria in it.
So by decreasing the number of caesarean sections that we do, and obviously breaking skin by tears and episiotomies, we will further decrease our antibiotic use, keeping antibiotics working for our children and grandchildren.
Using a Freedom of Information request,
Mr. Jeremy Hunt obtained figures that show 952 million was paid in compensation and litigation related to maternity services 2018-2019.
Mr. Hunt wrote, something has gone badly wrong when, by comparison, obstetricians and gynecologists working in the NHS in England earn a total of 586 million during the same period. He criticised hospital trusts after Freedom of Information requests showed only 14 after 59 of provided meaningful data on needless deaths, while Health Secretary in 2017 Mr. Hunt ordered trusts to publish information on the number of avoidable deaths in hospital. We have appallingly high levels of avoidable harm and death in our healthcare service system.
In healthcare, we seem to just accept it as unavoidable.
Earlier This year it was revealed that Healthcare Safety Investigation Branch has been investigating East Kent Hospital University NHS Foundation Trust since 2018 following a series of baby deaths. In February the government announced an independent review into what happened, led by Dr. Bill Kirkup, who led the investigation into the serious maternity failings at Morecambe Bay and who confirmed as full panel at the end of June. The responsible body ultimately is the General Medical Council. They are responsible in maintaining high standards of medical education, and by denying mothers the advances in obstetrics, epino and anebol, they are ultimately responsible for these deaths. This is the article in the Washington Post online. Healthy mum gives birth at hospital. Days later, a flesh-eating bacterium strikes. Lindsay Hubley, 33-year-old first-time mum. She was discharged at 48 hours for having given birth, and 24 hours later developed sharp stabbing lower abdominal pains. Came back in, was seen and told constipation, and went home. And 24 hours after, she deteriorated. She was confused, unable to sit. Husband called an ambulance. She was admitted into hospital. Diagnosis of necrotizing, rotting fasciitis. Fascia is the covering of the pelvic floor muscle. Was made. She had septic shock and multi-system organ failure. She was taken immediately into hospital, placed into a hospital-induced coma, drug-induced coma for pain relief, and all 4 limbs were amputated. Her uterus and ovaries were also removed, and she presently is awaiting for kidneys. These cases all affect first-time mothers. If you'd stretched skin, there'd have been no tearing, no loss of limb, no loss of uterus and fertility. Hubley was suffering from secondary septic shock and experienced multi-system organ failure. Doctors eventually determined the patient had a group A strep infection, which is a bacterial infection, triggered necrotizing fasciitis. According to the Centre of Disease Control Prevention, the condition is rare, occurs when bacteria enter the body through an open wound, a tear or a cut, an episiotomy, and the infection is fast acting. Hubley was placed into medically induced coma while doctors worked to repair her damaged tissues, the pelvic floor, but the condition meant Lindsay Hubley would lose her hands and her legs below the knees. In March, a spokesman for Nova Scotia Health Authority confirmed to the Toronto Star newspaper that the province had seen 7 separate cases in the first 3 months of 2017. Lindsay Hubley's attorney told the Canadian press that all this could have been avoided. It is interesting in this case that even before it has gone to court, despite there being an umbrella of secrecy, the confidential neonatal and maternal mortality report, that it is public. Tearing can be reduced. Episiotomies can be totally avoided if mums are fully informed, and then the risk of getting infection into a damaged pelvic floor held together by stitches, muscle surrounded by fibrous tissue, causing this very dangerous infection called necrotizing fasciitis. Necrosis means rotting fascia, the covering coats of the muscles, can be avoided, and deaths of mums, these admittedly rare deaths of mums, can also be avoided. The gain of possibly in the future improving the sacral nerve stimulator that is used to stimulate the remaining bit of live pelvic floor muscle on the side of the episiotomy to increase continence, urinary continence and fecal continence in the elderly. That elusive goal of being able to treat other conditions with the improved sacral nerve stimulator is far outweighed by the potential loss of antibiotics, irreversible loss, where bacteria again control human population size as they did before the antibiotic era, and a world of widowers where women die in their 40s from acute cholecystitis because we have no antibiotics. We should fully consent mothers, we should fully inform mothers of what an episiotomy is. The cutting of skin, erectile tissue around the birth canal, the pelvic floor muscle and the cling film lining the peritoneum of the abdomen, leaving the mother vulnerable to deep-seated infection in the pelvic floor called necrotizing fasciitis, and some mothers lose their lives because of it. And it's yet episiotomy is totally avoidable. Episiotomy non is the promise in the title of the world's first birth trainer, made by a German hospital consultant obstetrician, Wilhelm Hopkins, that went worldwide in January 1999. And now we have an improved version called Annibal, which is Czech and went worldwide in 2014. We all know that Japanese and German technology is highly respected. BMW's Bosch washing machines are German. Germans are first, and Germans are first with the world's first birth trainer. Our babies and our mothers should be benefiting from it. And we now have a birth companion or doula. The doula promotes the advance in obstetrics in terms of Epino Delphine Plus, the world's first birth trainer. So the government are on our side. We can share the good news in supermarkets, wherever we meet, that birth can be made more gentle both for baby and for mum.